Ooh, ah. Hello everyone, it's Ryan Liberty, and thank you for continuing this series on trauma, everything that you need to know. In this section, I'm going to talk about trauma symptoms. Now, trauma symptoms revolve around a traumatic stressor or a traumatic event, and they are going to present a little bit differently for everybody. Some factors like culture may play a role in how those symptoms present, but we have different categories of symptoms, and some people may show more from one category than from another category, and typically people kind of have a mixed bag of symptoms from all the different categories. You may also find that the symptoms overlap with other disorders. For example, anxiety is very common when it comes to the symptoms of trauma, but let's get into what the categories of trauma symptoms are. So the ones we'll be talking about are intrusion symptoms, avoidance symptoms, anhedonic symptoms, dysphoric symptoms, arousal symptoms, and dissociative symptoms. Intrusion symptoms. Intrusion symptoms are when we have involuntary and unwanted distressful thoughts that feel like they're intruding upon us. The symptoms for trauma that are intrusive include recurrent memories of the traumatic event. In children, this might show up as play, recurrent dreams or reminders in our dreams of the traumatic event, recurrent dissociative reactions, also known as flashbacks, where we feel as though we're re-experiencing the traumatic event that we went through, and again, in children, this might look like play. Also, reactions where we have external cues in our environment and we react to them by undergoing a lot of stress. And finally, having a physiological reaction to those cues in our environment, which we would normally call something like a trigger. Avoidance symptoms. Avoidance symptoms are as they sound. They are symptoms where we avoid something that reminds us of the trauma that we went through. When it comes to trauma, there are two avoidance symptoms that we typically see. One is to avoid any reminders of the trauma that we went through, including external events. And another is to avoid any memories, thoughts, or feelings that remind us of the traumatic experience. Anhedonic symptoms. Anhedonia is when we find it difficult to experience pleasure in life. We have a hard time engaging in life's activities, and we find that we may be unmotivated and just don't have the energy to do the things that we like to do. Symptoms as they relate to trauma include diminished interest in significant activities, and for children this may look like social withdrawal, feeling estranged or detached from people, and a persistent inability to feel positive emotions. Dysphoric symptoms. Dysphoria is when somebody feels an intense depression, discontent, or indifference towards the world. Dysphoric symptoms as it relates to trauma include a persistent and exaggerated negative belief about oneself, others, or the world, persistent distorted thoughts about the cause or the consequence of the trauma that leads the person to blame themselves or others, and persistent negative emotional states. Arousal symptoms. Arousal symptoms have to do with how awake and alert somebody is. Arousal symptoms as they pertain to trauma include irritable and angry outbursts, reckless and self-destructive behavior, hypervigilance, exaggerated startle response, problems with concentration, and sleep disturbance. Dissociative symptoms. Dissociative symptoms are when mental constructs are split off from our conscious awareness. Now that could include your thoughts being split off from conscious awareness, or some emotional content might also be split off. When it comes to trauma, the symptoms include the inability to remember, recall important aspects of the traumatic event, which could be dissociative amnesia. There's also depersonalization, which is when you feel as though you are detached from yourself. And there's derealization, which is when you feel detached from the environment or the world around you. Putting it all together, Trauma symptoms all revolve around, at their core, a traumatic stressor or a traumatic event that somebody has experienced. Everybody's presentation of symptoms is going to be different. Some people may have more presentations of symptoms from one category, while a different group of people may show that they have symptoms from a different category. And everybody's probably going to have a mixed bag of symptoms from a lot of these different categories that we've talked about. Culture may play a role in which symptoms that you particularly present, because culture can teach us resiliency skills that help to buffer against the results of trauma, the effects of trauma, and help us to avoid some of the symptoms of trauma. So depending on your culture, you may see a different set of symptoms that shows up for you. When we're talking about trauma symptoms, there are different categories, and the categories are as follow: Intrusion Symptoms, Avoidance Symptoms, Anhedonic Symptoms, Dysphoric Symptoms, Arousal Symptoms, and Dissociative Symptoms. If you have any questions or comments about these symptoms, maybe you've experienced some of the symptoms yourself or you know a loved one who's going through them, please leave those down below for the community. And if you're enjoying this series on trauma and you'd like to know more, please go ahead and subscribe.